Most coronavirus infections are caught through inhalation of droplets floating in the air. Then again, it also sticks to solid surfaces and is transmitted through touch. PTV correspondent Cleizl Pardilla on the DENR, looking into COVID-19 infections gained from exposure to use and tainted vaccination kits and PPEs in trash or landfills.
COVID-19 test kits, COVID-19 vaccines, and face masks are just some of the things being used to fight the pandemic for the last 2 years, most of which are disposable. The World Health Organization Global Analysis of Healthcare Wastes estimates around 140 million test kits, 144,000 tons of waste from COVID-19 vaccines, and 87,000 tons of personal protective equipment were produced and generated in response to COVID-19 pandemic. The WHO report says 30% of healthcare facilities are not equipped to manage existing waste loads and COVID-19 medical waste. The UN agency warned it can potentially expose healthcare workers while impacting communities living near poorly managed landfills and waste disposal sites through contaminated air, water, and diseases carrying pests. In Viracat and Duanes, 8 people tested positive for COVID after having direct and physical exposure with medical wastes illegally dumped by a laboratory on the shoreline.
Pinaglaruan ang mga Inglesia at ginawa itong baril-barilan ng 23 na bata na naglalaro nito at kumpirmado ang positibong sa antigen test ang 8 nito. Kasama ang isang nanay.
The Department of Health condemns healthcare facilities mishandling hazardous medical wastes.
We are not going to tolerate this kind of irresponsible behavior. So pinapaalalahanan po natin ang laboratories, ang ating po mga ospital din, ang ating local governments, please dispose of your medical waste properly. Kasi pag hindi po natin ginawa yan, maaari pang kumalat ang ibang sakit dito sa ating bansa.
The Environmental Management Bureau admits increasing wastes from overwhelming number of patients have challenged healthcare facilities in managing their medical waste disposal. Despite this, healthcare institutions should be responsible in disposing hospital waste appropriately.
Ang isang facility kasi may capacity yon. So sa sitwasyon natin na talagang din tayo ready, hindi lang sa ating mga hospitals, meron pa tayong outside na mga quarantine facilities. So i-expect mo na triple, tsaka sobra pa sa triple yung ating volume na na-generate ngayon. Babala sa ating mga kasamahan from the hospital sector na alam nila ang kanilang responsibility at saka accountability, hindi lang sa kanilang business, but then even sa ating mga mamamayan.
The DNR is now investigating healthcare facilities violating environmental laws. According to the healthcare waste guidelines, hazardous medical waste should be segregated, put into a plastic bag and container, and should be treated before transporting to registered waste disposal facilities. Meanwhile, some environmental groups appeal to the government and private sector to use recyclable and sustainable materials for COVID-19 response.
Dapat conscious din tayo na there are also other ways of protecting ourselves na hindi kailangan gumamit ng disposable na mga protective gear. Invest in reusable gear and also to look at yung pag-reduce ng packaging related to healthcare na materials.
Cleizl Pardilla for The Nation.